renal cancer, cancer of the kidney, bladder cancer sa pantog, prostate cancer, ang dami, even leukemia, even fungal infection, nakakatulong daw ang transfer factor plus according to Dr. Pisa and his studies. So here, metastatic prostate cancer. Prostate cancer usually metastasizes or nakalat na sa bones, which is very painful. According to Dr. Pisa, effective daw ito. It's already level 1, category 8, phase 3 study. Non-small cell lung cancer, level 1, category A, phase 3. Bakit ba yung husband na smoke ng smoke ang nakaka-cancer yung wife na hindi naman smoker? Have you seen that? No? Yung husband, sige smoke. Pero yung wife na hindi nag-smoke, yun pang nagkaka-cancer ng lung cancer. Because the wife inhaled the secondary smoke. And her immune system is weak. That's why siya pintang nagka-cancer. The husband has a stronger immune system, kaya kahit ma-smoke siya ng smoke, hindi siya nagka-cancer. I'm not telling you to smoke and take transfer factor. So, the moral lesson there is build up your immune system to be protected against lung cancer. Nasopharyngeal cancer, also level 1, category A, phase 3 study. Even chronic active hepatitis. Ang mga tao takot sa hepatitis ba? Alam niyo bakit? Patay, basi mamatay sila. Kaya hepatitis, takot na takot sila. Chronic active hepatitis, they say that nakakatulong din daw ang transfer factor. Even head and neck tumor, head and neck cancer, very common. I don't know why very common sa Philippines ang goiter. And we also have a high incidence of thyroid malignancy here in the Philippines. Sabi nila, lack of iodine. But the Philippines is an archipelago. Ang dami nating seafoods dyan, which is a rich source of iodine. Bakit tayo nagkaka-goiter? Probably it's autoimmune in character. So which is the best? This one. Non-bacterial female cystitis. This is very common cause of UTI. As I've said, UTI, transfer factor plus. Even herpetic keratitis. Ito. This is a clinical study conducted by doctors on stage 4 cancer patient. When you say stage 4, the cancer has spread usually to the liver, lungs, brain, bones, kalat na siya. And the life survival is usually less than 6 months. We don't want to say that, no? Lalo na kung sasabihin mo sa patient would ask me, Doc, stage 4 naman kaya ako, how long do I have to live? I always tell them it is not mine to answer. It's always the one up there who tells you your time is up. I'm going to get you now, no? I always don't give the date. I don't tell them na, you have 6 months to live. Lalong hindi kakain yan, lalong namamatay ng maaga yan. So they conducted this on stage 4 cancer patient. So after 6 months, usually they have 3.7 months to live, but after 6 months, here's the result. 16 out of 20 weeks, and then 75% are still living after 6 months if they take transfer factor. That's very true. I've experienced that sa mga stage 4 cancer patient ko. Sometimes I thought 6 months, namamatay na. Almost 1 year, 2 years, buhay pa. Nakakapagtaka. Kaya I've seen wonders already with this product. That's why I'm here talking to you today. Otherwise, if I don't see it worked, I wouldn't be here convincing you to take it. First and foremost, you have to experience it in order to transfer your experience to your recruits. Ito naman, meron diabetes, yan, ganyan. Pag mangingitim na yung tuhod, mga paa, usually, when you go see the doctor, we will get a knife and chop it off. Chop na yan. But this lady took transfer factor. At you know, there's a product sa For Life against diabetes. Ano yun? Glucoach. Okay. February 12, March 8, 3 weeks lang ha, gumaling yung kanyang non-healing wound. There's your vascularization. Gumaling. Very good. Yung secretary kong isa, diabetic din. She has one like this in the foot. I gave her glucose, after 1 month, naging ganito na. So naniniwala din ako na it worked. This patient naman has a severe, quite rare, we call it ulcerative colitis or Crohn's disease. Oral manifestation yan. But taking transfer factor in just almost 1 month, wapa na siya. Ito naman, si Mr. Ronald has a severe infection of the hands. Usually we go to the ER, pag ganyan, chop-chop na rin yan. But he took transfer factor, probably with antibiotics also, in just 1.5 months. This gumaling, hindi na chop-chop yung kamay. This patient had shingles. Shingles is the cousin of chicken pox. Once you have chicken pox, hindi ka na magkakaroon ng chicken pox ulit. You will have the cousin, which is shingles or herpes zoster. And it usually affects one dermatome. Ganyan, sometimes masakit na masakit yan because it infects the nerve. Nerve ang ina-atake yan, kaya masakit yan, shingles or herpes zoster. So this patient took transfer factor in just 4 days. Gumaling na yung kanyang shingles. Viruses, transfer factor is really very effective against viruses. After transfer. Plus is good for infection, cancer. The advance is good for allergy, asthma, autoimmune diseases. Ito sa paa. Gumaling din. Usually, mga ganyan, naku, chop-chop na yan. Buti na lang, yung plus, kasi infection eh. As I've told you, I was a skeptic before. Sino ba naman doctor sasali ng direct selling? I don't like to recruit actually, no? But I just believe in the product, that's why I asked you to come here if you're my patient. So I was a skeptic before. And I deal with breast cancer a lot of times. So here's my patient 2 years ago which operated on mastectomy. Ito yung mastectomy scar niya, tinanggalan ko ng suso. And then, she underwent chemotherapy surgery na yan. Chemotherapy siya, yung pinakamahal pinili niya, tag 60,000 per cycle. For 6 cycles, that's how much, 360,000. She underwent radiation. Medyo advanced na kasi kaya nag-radiation din siya. Radiation is how much? 86,000 pesos. She also underwent hormonal. But during that time, wala pang cancer factor yun. Ha? So ito, after 2 years of chemotherapy, hormonal therapy, radiation, nag-recur pa rin. Probably it's her immune system that is really weak. So ito yung recurrence. Nakita niyo yung mga bukol-bukol na yan. These are all recurrence. Hindi ko na kaya operahan yan. Alangan, laplato ni Nemo to buong chest wall. So I just did a biopsy of one of the nodules, tinanggal ko itong nodule, just to confirm kung totoo bang breast cancer. So the biopsy came out to be invasive ductal carcinoma, so recurrent yun. We did a hormonal study, it's negative, so hindi siya pwedeng hormonal tablets. Hindi pwedeng hormonal tablet, chemotherapy ang last recourse niya. Nung sinabi ko na, the only treatment now is chemotherapy, umiyak na siya, Dok, ayaw ko na talaga ng chemo, Dok. Bakit wala ka ng pera? Meron naman do, pero hirap na hirap daw siya. Buti na lang, Mr. Moises Abuan, who was very kulit at that time to recruit me, sabi ko, sige nga, mag-iwan ka nga ng sample. So he left with me 1 bottle, which I did not mind, nilagay ko lang doon sa shelf, almost 1 or 2 months din yun sa shelf. Nakita ko yun, binigay ko sa patient. Sabi ko, this was given to me as a sample, you might as well have it. So I tried her 5 capsules 3 times a day. Ilang capsules yan in a day? 15. 5 before breakfast, 5 before lunch, and 5 before dinner. After 1 month, bumalik na naman. Nakita ko na yung patient card sa table ko. Naku, ano naman kayang gagawin nito? Ano naman kayang complain? Doctors do that also. We think before you come in our clinic. Naku, ano naman kaya ito? Sige, tinawag ko na, intercom. Okay, papasukin na. Nung pumasok, niyakap ako, Dok, this is what happened. Salamat, Doc, at binigyan mo ako ng transfer factor. Alam ko talaga na she is not taking other drug. There is no other medication. She was not on chemotherapy, dahil ako naman nag-chemo. She only took transfer factor, 5 capsules, 3 times a day. After 1 month, no, naugatan na. This is before And after, in just 1 month, her immune system worked and she had a cure. That's why I became a believer. Ito yung pusa namin, transfer factor. If it works for humans, it might as well work for cats. Yung aming Persian cat, one day, ayaw na kumain, nakahiga na doon. No, nagtatay, nagsusuka. I gave her one capsule lang ang nilagay ko sa food niya. Her favorite is tuna, yung naka-canned good pa na tuna. Nilagay ko doon, kinain naman niya. The following day, she was up and about. So if it's good for humans, it comes from animals anyway, it's also good for animals. Actually, one of the presidential diamond, sino ba yun?
Taas daw, gitna.
Ito, no? She is Dr.
Mak Yang.
Mak Yang. He looks old. Okay, si Mak Yang. Ano siya, veterinarian. He gives it to his mga dogs daw din. So what else? So here are our products. Ito yung the best we have in the market. Ito yung top seller natin, Transfer Factor Plus. Very good for infection, for cancer. Ito, this is very good for allergy, asthma, autoimmune diseases. We have the cardio for cardiac patient. We have hypertension, ischemic heart disease, yung mga bypass candidate. This is very good. Kasi ang testimony naman ito, iba-bypass na sana, take nito. Kung i-check, i-angio, wala na yung mga clogs. And this one, Blue Coach, is very good for diabetes. If you have mga facial cream, face wash, this also contains transfer factor in the form of lotion, ointments, and so forth. And ito pang bata. Children cannot take the capsule form, they can take the liquid form. 2 tablespoons once a day for kids. I recommend 3 times a day for my cancer patient. Once you open it, put it in the ref. When you put it in the ref, ilagay mo sa taas. Bakit ilagay mo sa taas? Kasi kung mababa, baka binuksan ng bata yung ref, binuksan, ilagyan ng screw at inubos yung isang bote mo na patay, 2,100 ubos. So kailangan i-refrigerate ito. Ito naman in sachet form, when we go abroad, we bring this one. Isang bukas lang at inumin na. So light blue, very good for allergy, asthma, psoriasis, yung mga ganun, autoimmune diseases. And the liquid form for the kids. Some ladies even take this one because this contains acai berries. At yung mga berries niya. Yan, ang dami niyang berries. Acai berries, pomegranate, blueberry, elderberry, purple grape, apple. All these are pampaganda daw ng skin. So some ladies take the transfer factor Rio Vida for beauty purposes. But these are also good antioxidants. And the blue is for infection and for cancer. It contains all these. Yung transfer factor plus advance. Okay, so if you want to take the transfer factor seeking balance, down regulation, allergies, autoimmune diseases, take the light.